So you now know that you have diabetes in your pregnancy, but you were in your consult with your doctor and you are not quite sure what the way forward will be in terms of what treatment you will need to have. Do you need to go straight to treatment, or is there anything else you can do to manage the diabetes in your pregnancy conservatively? Hi, welcome to Hey Doc. Here on this channel, I talk all things women's health, fertility medicine, and also on this channel, we have started talking about all things to do with pregnancy. I am Dr. Katie, a board certified family doctor, and I have a special interest in women's health, fertility medicine, and pregnancy related issues. So having said that, let's dive into today's topic, which is how to monitor your blood sugar in pregnancy whilst you have been told that you've got diabetes in your pregnancy. But also we are going to address the treatment options for our ladies who have diabetes in pregnancy. If you want to know more about diabetes in pregnancy, how it happens, the risk factors, how we as doctors diagnose you with diabetes in pregnancy, but most importantly, most ladies will be worried about the implication of that diagnosis for their baby as well as what it means for them. I have done a separate video on all of these on this channel, so do make sure that after watching this video, you go ahead and watch that video to have a full understanding of what diabetes in your pregnancy means. So now that you know that you have diabetes, you are not going to sit around and mope about it, but you are going to ensure that you do the right thing, and most importantly, that you are on the right treatment. That's exactly why I'm doing this video. So the first thing is, how do you monitor your blood sugar if you have just been told that you have diabetes? For our ladies who have had diabetes, either type 1 or type 2 diabetes, before they fell pregnant, they are going to be fully aware that in order to monitor your blood sugar, you need a blood glucose monitoring machine. So for you, if diabetes is a brand new thing and you have no awareness of what diabetes is, you've never had to deal with it, a blood glucose monitoring device will be something that is new for you. There are different models of blood glucose monitoring machines, just simply because different manufacturers make them, and as a result, there are also different test strips. Now, in order to be able to use the blood glucose monitoring machine, you must have a test strip, and you must ensure that when you are provided these test strips, they are the correct test strips for the blood glucose machine that you are going to use. A specific blood glucose machine will only be able to work if you have the correct test strip. Then you also need a Lancet machine. In this machine, you will be using a small needle, which you will use to prick your finger. And the blood that will be oozing out of your finger will then go on the test strip machine that is inserted in the blood glucose monitoring machine. And the blood glucose machine will then be able to give you what your blood glucose level is. Back to the Lancet machines. Do you have to have a Lancet machine? Not really. Look, all it does, it just ensures that the needle pricks you very quickly, and that's it. You don't have to use the needle to prick yourself. The Lancet machine will eject the needle quite quickly, and you'll feel a small scratch, and there you have it. You have the blood that you'll need to put on the test strip. Now, if you can't afford a Lancet machine, ladies, you can definitely do without it. You will just have to make sure that you're using a sterile needle each time you are pricking yourself to get a blood sample. Now, this is so important, ladies. You cannot use the same needle over and over again. You risk infections if you do that. So remember, you'll need a box of Lancet needles that you will use once each time, and dispose of the needle each time you are finger pricking yourself. Now, also remember, if you decide that you're going to use a Lancet machine, not all needles will fit into a Lancet machine. So whilst it's advantageous to have a Lancet machine, you don't have to have one, remember. Now we've spoken about how to do a blood glucose test using a blood glucose machine. You will also need a logbook. The reason why a logbook is important is because each value that you are going to get, you're going to be able to write it down. And this logbook that you're going to get will be taken to your doctor. And the values that you'll be writing down in this logbook is what your doctor is going to be able to use in order to determine which kind of treatment that you need for your diabetes in pregnancy. Now, when should you be monitoring your blood glucose levels? In other words, how frequently should you be finger pricking yourself? The answer is, if you are going to get a good maintenance of your blood sugar in pregnancy, ladies, it is going to be multiple times a day. I would say in order for your doctor to have a good idea of what your blood sugar control is, you should be doing a fasting blood sugar level at least 3 to 4 times a week. You should be doing a pre-meal blood sugar level. Now, what should those meals be? Should it be all 3 meals of the day? I would say doing a pre-meal blood sugar level for your lunch and your dinner. Those would be the most significant meals for you to do the blood sugar levels before you start having those meals. The next blood sugar level should be checked 1 to 2 hours after each meal. Now, if you're a lady who does not mind finger pricking yourself to check your blood glucose levels, then by all means, go for breakfast, lunch and dinner. However, if you are quite squeamish and you struggle to finger prick yourself, I would say limit yourself to doing lunch and dinner. Finally, as it relates to blood glucose testing, if you are a lady who has been started on insulin, either because you have type 1 diabetes or you have diabetes that you have developed in your pregnancy, which is called gestational diabetes, whatever type of diabetes you have, the importance is if you are on insulin, you must also check your blood sugar levels before you go to bed. So now that we know how frequently we should be checking our blood sugar if we have diabetes in pregnancy, what are the blood sugar ranges that your doctor is going to use in order to decide what kind of treatment that you need to be on? Let's look at those individually. The fasting blood glucose range, which is of course what your blood sugar is when you first wake up in the morning, the range should be 5.3 millimoles per liter or less. 1 hour after you have had your meal, your blood sugar should be 7.8 millimoles per liter or less. And 2 hours after your meal, your blood sugar should be 6.4 millimoles per liter or less. Next, we're going to look at how to manage diabetes in pregnancy. We're going to divide it into a few groups. First, the type 1 diabetic ladies. So these are the ladies who had diabetes before falling pregnant. If you watch my previous video on diabetes in pregnancy, you will understand that there are different types of diabetes. Type 1 diabetes, very briefly, are the ladies who develop diabetes very early in life as a result of an autoimmune condition that attacked the cells in their pancreas that produced insulin. So these ladies became deficient in insulin very early on in life because of an autoimmune condition. So for you ladies with type 1 diabetes, you will know that you have managed your diabetes for many, many years being on insulin. Now, when you fall pregnant, one of the first things that should happen during your first antenatal consult is that your doctor should be referring you quite early on to your endocrinologist. And your endocrinologist very likely will ask you to continue on your insulin therapy. But what may change is maybe the dosing, because remember the placenta and the fetus will be making an increased demand on your blood sugar. So your endocrinologist is likely to adjust the dose of your insulin. In addition to adjusting the dose of your insulin, what is likely also to be slightly different for you is that you are going to be asked to measure your blood glucose levels more frequently. On to our ladies with type 2 diabetes. Again, type 2 diabetes is a type of diabetes that develops later on in life as a result of insulin resistance of the cells and various other factors that cause an individual to become a type 2 diabetic. Again, if you want to understand more about type 2 diabetes or the types of diabetes in pregnancy, go back and watch the video that I've done on this topic. For ladies who had type 2 diabetes before they became pregnant, there is one group that would have been just controlled on diet and exercise. These ladies would not have been on any anti-diabetic medication. They would have just kept their blood sugar in a good range by just eating well and exercising. If that is the case and you fall pregnant, again, what will be different for you and what must happen for you in your first antenatal consultation is that you reveal to your doctor that you have type 2 diabetes, and you should be referred early to an antenatal care that will include an obstetrician as well as an endocrinologist. Why? Because they will monitor your blood sugar and will be able to tell when you should be transitioning from just diet control to being on medication. That is for our ladies who have type 2 diabetes before they became pregnant and were just on diet control. For our ladies who were type 2 diabetic before becoming pregnant and they were on medication to control their diabetes, so their diabetes needed more than just diet and exercise, and they were actually taking medication orally, these ladies should also be referred to an antenatal care that will include an obstetrician and an endocrinologist. These ladies, again, will have to measure their blood sugar more frequently in the way that I have just described, but they are likely to be asked to stop certain anti-diabetic medication. Up until now, the only oral anti-diabetic medication that is considered to be safe in pregnancy is metformin. There is another oral anti-diabetic drug that can be used in pregnancy. It is known as glibenclamide. So for ladies who cannot use metformin for whatever reason, their endocrinologist may put them on glibenclamide. But this drug is not very commonly used in pregnancy. You may see it rarely, but it is less ideal because it causes hypoglycemic episodes. So if metformin really isn't appropriate, most doctors will get their patients on insulin rather than going for glibenclamide. But I thought I'd mention it because it is an oral medication that is safe in pregnancy. So to summarize, for our ladies who are type 2 diabetics who are on oral medication to control their blood sugar and they are on multiple oral medication to control their diabetes, they will also be seen by an endocrinologist. What is likely to happen is that all the other anti-diabetic medications apart from metformin are likely to be stopped. And if this lady is someone who controls her type 2 diabetes quite well and all of the other medications are stopped and she's just put on metformin, but she manages to control her blood sugar and her blood sugar remains within the ranges that I previously mentioned, then it is very likely that her endocrinologist together with her family doctor are likely to ask her to continue on just metformin. Now, we have considered our ladies with type 1 and type 2 diabetes and how to manage them in pregnancy. Let's move on to our ladies with gestational diabetes. Gestational diabetes is a type of diabetes that happen in the second or the third trimester of pregnancy. So these ladies did not have diabetes before, or if they did have diabetes, they only had diabetes in their previous pregnancies. The first line treatment for these ladies with gestational diabetes, assuming that their blood sugar is not drastically out of the blood sugar ranges I previously mentioned, those ladies, the first line of treatment will be diet and exercise. I continue to mention diet as one of the ways to control your blood sugar in pregnancy and managing diabetes in pregnancy. I promise you, ladies, I'm going to do a separate video and I'm going to look at the diet in detail, what you should be eating when you have diabetes in pregnancy, and possibly will also address what you should not be eating. And I will show you the vegetables and the fruits and all of that stuff. We will go through it together in detail. And once you've gone through that video, you will be able to tailor your diet and your meals around some of the suggestions that will be made in that video. It's going to be great, I promise you. But for this video, we're just going to be focusing on medication. So for ladies who have gestational diabetes, who have continued to struggle to manage their blood sugar despite being on a good diabetic-based diet and exercising, the first line medication they need to be put on is insulin. Now, Insulin is a hormone that will normally be released by your pancreas in order to lower your blood sugar. Now, if your pancreas is not making enough for whatever reason, you need to be given an injection that will contain this hormone in order for you to still be able to lower your blood sugar, despite the fact that your pancreas is not releasing enough insulin. Now, there are different types of insulin, and which one you receive will depend both on the type of diabetes that you have, but also on your overall blood glucose control. There is rapid acting insulin, which tends to be given just before meals in order to control the spike in blood sugar rise that happens after eating. We also have short-acting insulin, and the onset of the action of this type of insulin is usually 30 minutes, and its action will tend to last 5 to 8 hours. The difference between rapid-acting and short-acting insulin is that short-acting insulin, although it's also taken just before meals, is that short-acting insulin usually requires a more precise timing of administration as opposed to rapid acting insulin. There is intermediate acting insulin, which can be used throughout the day or overnight. The duration of action of this type of insulin is anything between 12 to 18 hours. Finally, there is long acting insulin, and the duration of action of this type of insulin is 24 hours. It is purposed to provide a basal coverage throughout the day. So you see, ladies, there are different types of insulin, and if you are started on insulin by your doctor, and usually that should be an endocrinologist, this doctor should sit down with you and explain which type of insulin you should be using and when. And the type of insulin that will be picked for you will be dependent on your blood sugar levels that you would have recorded in your logbook or an app. So remember, ladies, it's not enough to just prick yourself and to get the values. You need to write them down, because it is based on these values that if you are needing to be started on insulin, that doctor will be using those values to decide which insulin is best for you. So I mentioned metformin. Let me tell you a little bit more about this drug. Before I do, though, I want to reiterate that for patients with diabetes in pregnancy, that will be type 1 diabetics, ladies with type 2 diabetes whose blood sugar is not well controlled with just metformin, diet and exercise alone, then patients with gestational diabetes, and that is ladies who develop diabetes in pregnancy. For these three groups of diabetes in pregnancy, insulin will always be the first line treatment. So the main way of controlling diabetes in these three groups of patients. But metformin does play a role. For ladies with gestational diabetes or type 2 diabetes that was previously managed with just diet and exercise, often you will see that the endocrinologist will not just go for insulin, although it is first line and it is appropriate to use. And that will be for various reasons. Some ladies have a lifestyle that is very busy, which means that injecting themselves with the different kind of insulin would be very inconvenient. Some ladies have a total phobia of needles. Some ladies, if they are given insulin, are at a greater risk of hypoglycemia, and that is a big drop in your blood sugar that will cause a woman to feel dizzy and falls and various other complications. So in this group of ladies, insulin, though it is first line, it will be less ideal to go straight for insulin in this group of ladies. So that is where metformin plays a role. Insulin is a great drug. It is an anti-hyperglycemic agent that has been around for many, many years. And it works in different ways in order to be able to lower the blood sugar, which includes reducing the liver's production of glucose. It works by increasing the cell sensitivity to insulin, as well as reducing the gut's absorption of glucose. As it relates to controlling diabetes in pregnancy, metformin is great at lowering the fasting blood sugar, as well as the fasting blood sugar after meals. Sometimes the reason why the endocrinologist as well as your family doctor may choose metformin over insulin is because it has a lower risk of developing hypoglycemia in the mother as well as the fetus in comparison to insulin. Now, the only other thing I'm going to mention about insulin is that if you are started on insulin, the doctor should be asking you to start the drug gradually. So it will be take 1 daily for a week, then increase to 1 twice a day for a week, then 1 3 times a day for a week. And any further instruction will depend on how well you are controlling your blood sugar, and the dosing, quite frankly, will depend on how well you are controlling your blood sugar. So for a lady, she may be on take 1 3 times a day. Another lady may be kept on taking 1 tablet of insulin twice a day or even 1 a day. It all depends on the blood sugars. I am a doctor on YouTube making videos for educational purposes. I am not your doctor, and your clinical situation will vary. So make sure that you are sticking to the advice that your doctor has tailored for your situation. That is all I have for you ladies for this video. I truly hope, like all the other videos, it has been helpful. Some of you who've been following me for some time now will be well aware that I am a Christian doctor. Yes, I believe in medical science, all of which has been created by God. It is my firm belief that that is the case. And as a result, I believe in God's ability to help, support, strengthen, encourage, but also his ability to heal despite your situation and despite how hard and literally impossible to clinical science your situation might be. I believe that Jesus Christ is able despite the situation. So today I want to share with you a word of God. I want to sow the seed of truth from his word. I'm going to read from Isaiah chapter 57 verse 18 to 19. The word of the Lord reads, I have seen his ways and will heal him. I will also lead him and restore comfort to him and to his mourners. I create the fruit of the lips, peace to him who is far off and to him who is near, says the Lord. And I will heal him. I pray that despite the type of diabetes in pregnancy you may have been diagnosed with, that Christ will reign above it all and that you will have a safe pregnancy as well as a safe labor. God bless you, and we will see you in our next video. In the meantime, do remember to subscribe, to like and share our content. Until then, God bless you, and we will see you later.